So good afternoon, Professor Leenen. Could you quantify the impact of heart failure in the world?
Heart failure is becoming more and more common in most societies in the world. There was a recent survey that was done in the United Kingdom where they showed that perhaps per 100,000 people it's starting to go down, but because the population is getting older and older, the prevalence of heart failure is actually increasing and is becoming a bigger and bigger burden.
Are there still unmet needs?
At the moment there are a number of treatments available for the management of heart failure. Unfortunately, they are not very effective for prevention of progressive heart failure and ultimately of dying. So at the moment still the 1-year mortality, for example, of heart failure can be as high as 15%, what is higher than for many forms of cancer.
Could you describe how the actual treatments against heart failure work?
There are a number of treatments available at the moment for the treatment of heart failure that deal with different mechanisms that contribute to the heart failure. For example, they can block the increases in return of blood to the heart, they can decrease the blood pressure, they can decrease the effects of the sympathetic nervous system on the heart. All of them work fairly individually, and therefore patients will need a number of medications to try and help the symptoms and the progression of heart failure. And that means then that many patients end up on 4, 5, 6 different treatments, what can be very cumbersome and often causes side effects. But altogether, despite that there are so many, they're still not very effective for the prevention of dying.
What could be the new directions for research?
So instead of focusing on each of these peripheral mechanisms individually, one is considering at the moment what is causing the increase in the activity of these mechanisms, and that cause appears to be coming from the brain. So the brain, in a sense, integrates all stimuli coming from the heart to the brain, and then from the brain to the periphery, explaining all the different mechanisms that go up. So if you now interfere with the mechanisms in the brain that are being activated, one can thereby then inhibit the increases in the mechanisms peripherally.
So how could the new molecule developed by Quantum Genomics improve the treatment of heart failure?
To date, we had no medications that could specifically target the brain. So some of them would act in the periphery, and if you would give them in high doses, they would also get into the brain, but then that would lead to a number of side effects in the periphery. The new molecule or the new classes of agents that is being developed by Quantum Genomics focuses specifically on these brain pathways that are being activated and then contribute to all the activation of the peripheral mechanisms. And by doing that, you in a sense direct an orchestra how to go, and that then can prevent an activation of these peripheral mechanisms, and that can hopefully lead to prevention of the progression of heart failure and hopefully the progression of to death.
Thank you so much, Professor.
You're welcome.